Top 3 Best Breakfasts for Arthritis Relief. Reduce pain and inflammation naturally. An emotional opening that speaks directly to seniors struggling with stiff fingers in the morning, swollen knees, aching hips, and the fear of losing independence. It will gently remind them that breakfast, the very first meal of the day, can either calm inflammation or silently worsen joint pain. The hook will create urgency and hope, showing that simple, natural food choices can begin reducing arthritis discomfort from the very first bite of the morning. A warm and natural call to action, encouraging viewers over 50 to subscribe, like and comment if they want more natural joint support tips. It will feel caring and community-focused, like inviting them into a circle of people who want to age stronger, not weaker. A warm bowl of rolled oats topped with blueberries, strawberries, crushed walnuts, chia seeds, and a sprinkle of cinnamon is one of the most supportive breakfasts for arthritis relief, because it works gently with the body's natural inflammation control systems. Arthritis pain is not only about aging joints. It is deeply connected to inflammation that builds up over time. Certain foods calm that internal fire, while others quietly fuel it. This oatmeal bowl is designed to calm it from the very first spoonful of the day. Rolled oats are rich in soluble fiber, especially a type called beta-glucan, which plays an important role in supporting gut health. Many doctors now explain that the gut and the immune system are closely connected. When the digestive system is balanced and healthy, inflammatory signals in the body tend to be lower. Some research suggests that soluble fiber helps nourish beneficial gut bacteria, and these bacteria produce compounds that reduce inflammatory activity. For seniors living with arthritis, this matters because chronic inflammation can worsen joint swelling and stiffness. A simple bowl of oatmeal becomes more than comfort food. It becomes daily support for a calmer immune response. Soluble fiber also helps stabilize blood sugar levels. Spikes in blood sugar can increase inflammatory chemicals in the body. When blood sugar rises sharply and then crashes, it can create stress inside blood vessels and tissues, including the delicate lining of joints. Oats digest slowly, releasing energy gradually. This steady release prevents sharp fluctuations that may aggravate inflammation. For adults over 50, whose metabolism may not respond as quickly as it once did, this steady energy can make mornings feel smoother and joints feel less irritated. The warmth of oatmeal itself also has a comforting effect. Many people with arthritis report that stiffness feels worse in the morning, especially in colder conditions. Warm foods can gently improve circulation, helping blood move more freely through muscles and joints. While warmth alone does not cure arthritis, it can support mobility during those first hours after waking. When circulation improves, oxygen and nutrients reach joint tissues more effectively, and that may ease the tight, aching sensation many seniors describe when they first get out of bed. Adding blueberries and strawberries strengthens this breakfast significantly. These berries are rich in antioxidants, particularly anthocyanins, which give them their deep red and blue colors. Antioxidants help protect cells from oxidative stress, a process that can damage joint tissues over time. Oxidative stress is linked to inflammation and cartilage breakdown. Some studies suggest that diets high in antioxidant-rich fruits are associated with lower inflammatory markers in the blood. For someone managing arthritis, protecting joint cartilage from further damage is essential. Berries help provide that protective shield in a natural and gentle way. Blueberries, in particular, have been studied for their anti-inflammatory potential. Researchers have observed that compounds in blueberries may help reduce certain inflammatory pathways in the body. Strawberries contain vitamin C, which supports collagen production. Collagen is a key component of cartilage, the cushioning material between joints. As people age, collagen production declines, and joint surfaces can become less protected. Including strawberries regularly may help support the body's natural repair processes. This does not reverse arthritis, but it contributes to maintaining what healthy tissue remains. Walnuts and chia seeds add another layer of protection through their omega-3 fatty acids. Omega-3 are widely recognized for their role in reducing inflammation. Some doctors recommend increasing omega-3 intake for patients with inflammatory joint conditions, because these healthy fats can help counterbalance the pro-inflammatory fats often found in processed foods. Walnuts contain alpha-linolenic acid, a plant-based omega-3 that supports heart and joint health. Chia seeds are also rich in this beneficial fat, along with fiber and minerals. Inflammation in arthritis often leads to swelling and stiffness, especially in the fingers, knees, and hips. Omega-3 fatty acids have been shown in some research to reduce joint tenderness and morning stiffness in people with inflammatory arthritis, while plant-based omega-3 South are not identical to those found in fatty fish. They still contribute meaningfully to an anti-inflammatory diet. For seniors who may not eat fish regularly, walnuts and chia seeds provide a simple and accessible alternative. Chia seeds also absorb liquid and form a gel-like consistency. This gentle thickening effect supports digestion and slows nutrient absorption, contributing to steadier blood sugar levels. Their high fiber content works alongside the oats to nourish beneficial gut bacteria. A healthy gut barrier can prevent unwanted inflammatory substances from entering the bloodstream. This connection between digestion and joint health is now widely discussed in medical communities. Supporting gut balance through fiber-rich foods may be one of the quiet but powerful ways to influence inflammation. Crushed walnuts add texture and healthy fats that increase satiety. Feeling full and satisfied after breakfast reduces the temptation to reach for processed snacks later in the morning. Processed foods often contain refined carbohydrates and unhealthy fats that can worsen inflammation. By starting the day with a balanced meal rich in fiber, healthy fats, and antioxidants, the body is less likely to experience the inflammatory spikes associated with poor food choices. For someone managing arthritis, consistency matters. One supportive meal may not create dramatic change, but repeated daily choices can shift the body's inflammatory balance over time. This oatmeal bowl works because it combines multiple anti-inflammatory elements in one simple meal. Fiber supports gut health and immune balance. Antioxidants protect joint tissues from oxidative damage. Omega-3 fatty acids help reduce inflammatory signaling. Cinnamon adds additional antioxidant support and may aid circulation. Together, these ingredients create a breakfast that aligns with what many health professionals describe as an anti-inflammatory eating pattern. For seniors who wake up with stiff hands or aching knees, regular use of this breakfast can become a steady foundation for joint care. It is not a quick fix, and it does not replace medical treatment, but it complements the body's natural healing mechanisms. Doctors often remind patients that inflammation builds slowly over years, and calming it also requires patience and consistency. Choosing supportive foods each morning is one practical step within that long-term approach. The simplicity of this meal also makes it sustainable. Rolled oats are affordable and widely available. Berries can be fresh or frozen without losing significant antioxidant value. Walnuts and chia seeds store well and can be added in small amounts. Cinnamon requires only a light sprinkle. When something is easy to prepare and pleasant to eat, it is more likely to become a lasting habit. And lasting habits are what truly influence chronic conditions like arthritis. Using this breakfast regularly, especially in the early hours when joints feel tight and movement feels limited, provides steady nutritional support. It nourishes the gut, protects cartilage, supports circulation, and supplies healthy fats that calm inflammatory responses. For adults over 50 who want a natural way to support joint comfort, beginning the day with this warm, nutrient-rich bowl is a gentle yet powerful choice. A spinach and mushroom egg scramble cooked gently in extra virgin olive oil is a powerful anti-inflammatory breakfast that supports joint comfort and muscle strength. After age 50, this simple combination provides high-quality protein, protective antioxidants, and healthy fats that work together to reduce inflammation and protect aging joints. For adults living with arthritis, the first meal of the day can either support mobility or quietly contribute to stiffness. This breakfast is designed to support the body's natural repair systems from the very beginning of the morning. Eggs are one of the most complete sources of protein available in everyday foods. They contain all essential amino acids needed to maintain and repair muscle tissue. After the age of 50, muscle mass naturally begins to decline in a process known as sarcopenia. When muscles around the knees, hips, and shoulders weaken, joints lose part of their natural support system. This can increase strain, discomfort, and instability. Some doctors emphasize that maintaining muscle mass is just as important as protecting cartilage when managing arthritis. A protein-rich breakfast helps reduce overnight muscle breakdown and supports strength throughout the day. Protein plays another critical role in joint health. Muscles act as shock absorbers around joints. When muscles are strong, they help distribute pressure more evenly, reducing stress on cartilage and ligaments. In people with arthritis, joint surfaces may already be worn or inflamed. Weak muscles can allow additional strain, worsening pain and stiffness. By starting the day with eggs, the body receives the building blocks it needs to preserve lean muscle tissue. Research suggests that evenly distributing protein intake throughout the day, rather than consuming most of it at dinner, may better support muscle maintenance in older adults. Eggs also contain nutrients, such as vitamin D and choline, which contribute to overall cellular health. Vitamin D plays a role in immune regulation and bone strength. Some studies have found that low vitamin D levels are associated with increased joint pain in certain populations. While eggs alone do not provide all required vitamin D, they contribute to daily intake. Choline supports cell membrane integrity, which is essential for tissue repair and normal inflammatory responses. These nutrients work quietly in the background, supporting systems that influence joint comfort. Spinach adds a rich source of vitamin K, a nutrient that plays a role in bone metabolism and cartilage health. Vitamin K is involved in activating proteins that help regulate calcium in the body. Proper calcium regulation supports bone density and structural stability around joints. Some research suggests that low vitamin K intake may be associated with increased risk of osteoarthritis progression. Including spinach regularly can help provide this protective nutrient in a natural form. Beyond vitamin K, spinach contains antioxidants such as lutein and beta-carotene. Antioxidants protect cells from oxidative stress, which contributes to inflammation and tissue breakdown. In arthritis, oxidative damage can accelerate cartilage wear and joint irritation. By reducing oxidative stress, antioxidants may help slow this process. Some doctors explain that inflammation and oxidative stress often work together, creating a cycle that worsens joint discomfort. Foods rich in antioxidants can help interrupt that cycle gently and consistently. Spinach also contains magnesium, a mineral involved in hundreds of biochemical reactions in the body. Magnesium supports muscle relaxation and nerve function. For seniors experiencing joint pain, muscle tension around affected joints can increase discomfort. Adequate magnesium intake may support normal muscle relaxation, which can indirectly ease strain on stiff areas. While spinach alone does not correct deficiencies, it contributes meaningfully to overall intake. Mushrooms provide additional anti-inflammatory support through naturally occurring compounds, such as ergothioneine and beta. Ergothioneine is an antioxidant that may help protect cells from inflammatory damage. Beta-glucans, also found in oats, have been studied for their immune-modulating properties. In certain types of arthritis, the immune system becomes overactive, contributing to chronic inflammation. While diet cannot replace medical treatment for autoimmune conditions, some research suggests that beta-glucans may help support balanced immune responses. Mushrooms are also a source of selenium, an important antioxidant mineral. Selenium contributes to the function of enzymes that reduce oxidative stress in the body. When oxidative stress is controlled, inflammatory signaling may decrease. For individuals with arthritis, reducing overall inflammatory burden is essential for comfort and mobility. Including mushrooms regularly can support this protective mechanism in a simple and natural way. Cooking this scramble in extra virgin olive oil adds another crucial element. Olive oil is rich in monounsaturated fats, particularly oleic acid, which has been associated with reduced inflammation. It also contains polyphenols, such as oleocanthal. Some researchers have noted that oleocanthal has properties similar to mild anti-inflammatory compounds. While olive oil should not be considered a replacement for medication, its regular use is a central feature of dietary patterns, associated with lower inflammatory markers. Healthy fats from olive oil also help with the absorption of fat-soluble vitamins found in spinach, such as vitamins A and K. Without adequate fat, the body cannot fully utilize these nutrients. By gently sauteing spinach and mushrooms in olive oil, nutrient absorption improves. This combination enhances the overall effectiveness of the meal, ensuring that the body receives maximum benefit from each ingredient. Consistency is essential. Some doctors remind patients that inflammation develops over long periods and responds gradually to dietary change. Eating a spinach and mushroom egg scramble occasionally may not create noticeable improvement. However, using it regularly as part of a consistent routine can contribute to better muscle maintenance and lower inflammatory stress. Over weeks and months, these small daily choices accumulate. This breakfast also provides steady energy without excessive refined carbohydrates. Stable energy levels reduce metabolic stress, which can influence inflammatory pathways. When blood sugar remains balanced, tissues experience less oxidative strain. This stability supports overall joint health. Combining protein, fiber from vegetables, and healthy fats creates a balanced meal that sustains energy throughout the morning. For adults, managing arthritis, protecting muscle mass and calming inflammation are two foundational strategies. Eggs support muscle preservation. Spinach protects bone and cartilage structures. Mushrooms provide immune-modulating and antioxidant compounds. Olive oil delivers healthy fats and polyphenols that reduce inflammatory signaling. Together, these ingredients create a breakfast that addresses multiple aspects of joint health simultaneously. Regular use of this spinach and mushroom egg scramble with olive oil can help maintain strength around vulnerable joints, support smoother movement, and reduce inflammatory stress that contributes to stiffness. It aligns with what many health professionals describe as a practical, sustainable approach to managing joint discomfort through daily nutrition. By choosing this breakfast consistently, adults over 50 provide their bodies with steady support for both muscle strength and joint lubrication, two essential elements for maintaining mobility and independence. Plain Greek yogurt mixed with ground flaxseeds, sliced almonds, and a pinch of turmeric is a powerful inflammation-fighting breakfast that supports joint comfort and immune balance in adults over 50. This combination delivers high-quality protein, beneficial probiotics, protective antioxidants, and plant-based omega-3 fatty acids in one simple bowl. For individuals living with arthritis, calming the immune system and reducing internal inflammation are essential steps toward easing stiffness and protecting joint tissue. This breakfast is designed to provide that support naturally and consistently. Greek yogurt stands out because of its concentrated protein content. During the straining process that creates its thick texture, much of the liquid whey is removed, leaving behind a dense source of complete protein. After age 50, maintaining muscle mass becomes increasingly important. Muscles stabilize and protect joints, absorbing shock and reducing mechanical stress on cartilage. Some doctors explain that adequate protein intake is critical for slowing muscle loss associated with aging. By beginning the day with Greek yogurt, the body receives essential amino acids needed to repair and maintain muscle tissue around vulnerable joints. Protein also supports the production of enzymes and structural components involved in tissue repair. In arthritis, joints may experience ongoing wear and inflammatory damage, while diet does not cure structural changes. Providing sufficient protein gives the body resources to maintain what healthy tissue remains. Research suggests that spreading protein intake evenly across meals may improve muscle protein synthesis in older adults. A protein-rich breakfast therefore plays an important role in daily joint protection. Greek yogurt also contains probiotics, beneficial bacteria that support gut health. Increasing evidence highlights a strong connection between gut balance and immune regulation. The digestive tract houses a significant portion of the immune system. When gut bacteria are balanced, inflammatory signaling throughout the body may be reduced. Some studies suggest that certain probiotic strains can lower inflammatory markers in individuals with inflammatory conditions. Although results vary, many healthcare professionals acknowledge the gut-joint connection as an important area of research. In arthritis, especially inflammatory types, the immune system can become overactive, mistakenly targeting joint tissues. Supporting gut integrity may help regulate this immune response. Probiotics in Greek yogurt contribute to a healthier intestinal barrier, reducing the likelihood that inflammatory substances pass into the bloodstream. When systemic inflammation decreases, joint swelling and discomfort may also lessen. Regular intake of probiotic-rich foods can gently reinforce this balance over time. Ground flaxseeds add plant-based omega-3 fatty acids, particularly alpha-linolenic acid. Omega-3 are widely recognized for their anti-inflammatory properties. They help shift the body's production of inflammatory compounds toward less aggressive forms. Some research indicates that higher omega-3 intake is associated with reduced joint tenderness and stiffness in certain populations. While plant-based omega-3s are not identical to those found in fish, they still contribute meaningfully to. Flax seeds also contain lignans, natural plant compounds with antioxidant activity. Oxidative stress plays a significant role in cartilage breakdown and joint irritation. By neutralizing free radicals, antioxidants help protect joint tissues from ongoing damage. In chronic arthritis, oxidative stress and inflammation often reinforce each other. Including flax seeds daily can provide a steady supply of protective compounds that interrupt this cycle gently. The fiber in flax seeds further supports gut health. Just as probiotics introduce beneficial bacteria, fiber helps nourish them. This combination enhances the overall impact on immune regulation. Some doctors emphasize that feeding healthy gut bacteria may be just as important as introducing them. Ground flax seeds are especially effective because grinding allows better absorption of their nutrients. When incorporated into yogurt, they blend smoothly and are easy to consume regularly. Sliced almonds contribute vitamin E, a fat-soluble antioxidant known for protecting cell membranes from oxidative damage. Vitamin E plays a role in defending joint tissues against the stress caused by chronic inflammation. Some studies have observed that individuals with higher vitamin E intake may experience improved joint comfort. Although results vary, protecting cartilage and surrounding tissues from oxidative harm is an essential part of managing arthritis progression. Almonds also provide healthy monounsaturated fats, which support cardiovascular health and help reduce inflammatory signaling. Chronic inflammation affects not only joints, but also blood vessels and surrounding tissues. By supplying healthy fats, almonds contribute to an overall anti-inflammatory dietary pattern. Additionally, almonds offer magnesium, which supports muscle relaxation and nerve function. Balanced muscle tone around joints reduces unnecessary strain and may ease discomfort associated with stiffness. Turmeric completes this breakfast with one of the most studied natural anti-inflammatory compounds. Curcumin has been examined in numerous clinical trials for its potential to reduce joint inflammation and stiffness. Some research suggests that curcumin supplementation may improve symptoms in individuals with osteoarthritis. While culinary amounts are lower than concentrated supplements, regular dietary inclusion can still contribute to overall anti-inflammatory intake. This breakfast supports immune balance through multiple mechanisms. Probiotics nurture gut integrity. Fiber feeds beneficial bacteria. Omega-3 fatty acids reduce inflammatory signaling. Antioxidants protect tissues from oxidative damage. Curcumin influences pathways linked to swelling and stiffness. Together, these elements create a calming effect on the immune system, which is particularly valuable for seniors experiencing chronic joint pain. Consistency remains essential. Inflammation develops gradually and often responds slowly to dietary change. Eating this combination occasionally may not produce noticeable differences. However, regular use can help lower the body's overall inflammatory burden. Some patients report improved morning comfort after adopting anti-inflammatory dietary habits consistently over several months. While individual responses vary, research increasingly supports the role of diet in influencing inflammatory conditions. Greek yogurt with flaxseeds, almonds, and turmeric provides balanced nutrition without excessive refined sugars or processed ingredients. Stable blood sugar levels contribute to reduced metabolic stress, which can otherwise worsen inflammation. By offering protein, healthy fats, fiber, and bioactive compounds in one bowl, this breakfast supports steady energy and immune regulation throughout the morning. For adults over 50 managing arthritis, calming the immune response is a daily priority. This simple breakfast works quietly to support that goal. It protects muscle tissue, nourishes beneficial gut bacteria, supplies anti-inflammatory fats, shields joints from oxidative stress, and introduces curcumin to help ease stiffness. Used consistently, it becomes more than a meal. It becomes a steady, natural ally in supporting joint comfort and long-term mobility. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.